If you have kidney disease, or if someone who you love does, here's an important question. When should your nephrologist, your kidney doctor, refer you to a renal dietitian? And honestly, what is a renal dietitian anyway? Hi, I'm Terrie Holewinski, and I'm a renal dietitian, a kidney dietitian who's been working with patients with kidney disease for over 20 years. And today, I'd like to talk to you about a few important things in helping you to care for your kidneys that you may not have been aware of. First, I'd like to explain to you exactly what a renal dietitian is and what role we play in kidney disease. And I'll give you a clue. We are not the food police. Second, I'd like to share with you why nutrition isn't about just healthy eating, but it's considered medical nutrition therapy for kidney disease. And third, recommending to you when you should be meeting with a renal dietitian, because timing truly matters. Helping you to understand these three things can make a real difference in helping you to protect your kidney function and improve the quality of your life. So let's get started. So what exactly is a renal dietitian? A renal dietitian is a nutrition expert who specializes in kidney health. But more importantly, we help translate all that confusing medical information into easy to understand terms and to help you choose foods that can help protect your kidneys. We don't just hand you a generic kidney diet for you to follow or give you a list of foods that you should or should avoid, because nutrition therapy isn't one size fits all. A renal dietitian helps you to understand your blood lab tests, what they actually mean, like potassium, phosphorus, albumin, and then show you how to build your meals to support your kidney health, while still being able to enjoy many of the foods that you love. Because how many of you are afraid to eat for fear you might cause further harm to your kidneys? If this sounds familiar, you're not alone. I hear it often from my patients. Now, you might be wondering, what does it take to become a renal dietitian? Well, there's actually quite a bit of training. First, we have to complete a 4-year college degree. Then earn a master's degree in nutrition or in a related field. Then we must complete a supervised internship program. And after that, we must pass a national registration exam. But our education doesn't stop there. We also have to maintain continuing education credits to stay up to date on the latest research in nutrition, especially as it relates to our kidney health. So you see, working with a kidney dietitian, you're working with a highly trained medical nutrition expert. And renal dietitians work with people at every stage of kidney disease. And that includes people with chronic kidney disease, stages 3 to 5. Patients who are on dialysis, and patients who have received a kidney transplant. And over my 20 years of working with kidney population, I've worked in all 3 areas. but my passion is working with chronic kidney disease patients and helping them to manage their chronic kidney disease, because that's where I truly feel that I can make the biggest impact on my patients' lives. We know that individual nutrition care can help slow down the progression of CKD, protect kidney function, and potentially delay or avoid needing kidney dialysis. So that's why I'm so passionate about the work that I do with my patients. So why is nutrition so important to our kidney health? Well, kidney disease is progressive, meaning that it gets worse over time. But here's an encouraging part. Nutrition can truly make a difference. As I said a few minutes ago, the right nutrition plan can help. The right nutrition plan can help slow down the progression of your kidney disease. It can help you to get better control of your blood pressure and blood sugars. It can help improve your blood lab tests, such as potassium, phosphorus, albumin. And it can improve the quality of your life and helping you to feel confident in the foods that you're eating and that you're doing everything possible to protect your kidney health. So you see, medical nutrition therapy isn't just generalized healthy eating advice. It's personalized, science-based treatment plan created to help manage your kidney disease and to protect your health. I think of nutrition as food as medicine, and healthy eating for your kidneys isn't easy. It does require some effort, but many of my patients think it is worth the time and effort that they put in. So now that you have heard about the importance of meeting with a dietitian, when should your nephrologist, your kidney doctor, refer you? And here's a startling statistic. 90% of patients with chronic kidney disease don't see a dietitian until they start dialysis. And the National Kidney Foundation and the Academy of Nutrition and Dietetics agree that meeting with a renal dietitian and receiving medical nutrition therapy is one of the most important ways to slow down the progression of kidney disease and to prevent kidney failure. And it's important for people with kidney disease at all ages to receive medical nutrition therapy. And I recommend to my kidney doctors to refer their patients to me in the very early stages of kidney disease, at stage 3, because that's where I feel we can make the biggest impact in helping to slow down the progression of kidney disease. Because delaying a nutrition referral can be a missed opportunity. I often hear my patients say, "No one told me that I should or could see a kidney dietitian to help protect my kidneys." Or, "I didn't know there was such a thing as a kidney dietitian to help me with my diet." Or, "Terrie, why weren't you recommended to me sooner so I could have prevented further damage to my kidneys?" And by the time symptoms start to appear, kidney damage is often advanced. An early nutrition referral allows for prevention instead of reaction by helping patients to improve their blood sugars and their blood pressures, which we know is the number 1 and 2 leading causes of the progression of kidney disease. Providing personalized education information so that you're not just getting a generic diet sheet to follow, but medical nutrition therapy individualized for you. And patient empowerment, knowing that you are doing everything possible to protect your kidney function. So let's recap. Seeing a renal dietitian, it's not about being told about what you can and can't eat. We're not the food police. It's about having personalized, science-based nutrition plan to protect your kidneys and your overall health. Medical nutrition therapy is real treatment tailored for you based on your labs, stage kidney disease that you have, and your lifestyle. We know that it can help slow down the progression of your kidney disease and helping you to manage your blood sugars and your blood pressure and empowering you to eat with confidence and knowing you are doing everything possible to protect your kidneys. Seeing a dietitian in the early stages of chronic kidney disease matters. Nutrition intervention is most powerful before kidney disease advances. You don't have to figure out your nutrition plan alone. The right nutrition plan can make a real difference in your kidney health. Don't worry, you've got this. And if you need help finding a dietitian in your area, I've provided you with a website for the National Kidney Foundation to help find a dietitian in your area, and I've put the link below. If you're ready to take the next step in protecting your kidney health, visit my website, KidneyIntel.com, and explore my online class, Kidney Essentials, for practical, easy-to-follow strategies on nutrition and everyday choices to support your kidney health. You'll also find my link to my website below. I hope you found this video to be helpful. Please like me and share this video with someone who you feel can benefit from it too. Until next time.